I'm Dr. Diaz. I am the Department Chairman of Orthopedic Surgery at Palmetto General Hospital. I specialize in total joints and also sports medicine. At Palmetto General Hospital, we have a three-tier protection system. Those three tiers consist of red, yellow, and green zones. That means that patients that come in for elective surgery will be stabilized and placed in the green zone, which is a complete COVID-free floor. Now, those patients that come in that are not necessarily positive for COVID, but that are having an investigation will go in the yellow. And in the red zone are those patients that are positive for COVID. Everybody is allocated, and triage is a better word for it, according to what they come in. Most patients that have elective surgery at Palmetto have a COVID test prior to the elective surgery. And if they get placed to rehab center post the surgery, they have another COVID test. So they're going to go to a rehab center, which is basically completely COVID-free. There's an extreme concern about people delaying care because they're afraid. They're afraid that they might be placed in a place where it's infected with COVID. And I wanted to make sure that I can calm everybody's concerns regarding that, because we don't take any chances here. We are extremely cautious, and we make sure that all patients get positioned in the appropriate zone to minimize all risk from becoming contaminated with COVID. If someone delays their care because they're afraid, what's going to happen is it makes an elective surgery a lot more difficult and a lot harder for the person to recover. I'll give you an example. Examples such as a total knee. When somebody is bone on bone and they're hurting and their quality of life is extremely affected, you should do something about it. Do not wait, because what happens is the longer you wait, the greater the complications and the more difficult the surgery. And as far as rehab is concerned, it's going to be very difficult for the person to rehab the longer they wait with that kind of problem. As far as healthcare and what have we learned from the pandemic, this started back in March. And what we learned is that we need to take extreme precautions. And here at Palmetto General Hospital, we take those precautions. Everybody has PPE, which is personal protective equipment. Those people that work in those COVID floors, or i.e. the red floors, as well as the yellow. And we limit the nurses to those areas. They don't go and take care of other patients that are in the green zone. So we've learned a lot when it comes to personal care and to make sure that we are not a culprit as far as spreading the disease. I feel very secure because I know that proper steps are being taken. And I will not bring a patient into the hospital unless I am guaranteed that the patient is going to a green zone. So from my personal standpoint, my protocol is that when I do a total joint, an elective procedure, or a total hip, they only stay in the hospital for 23 hours. My patients go home the next day. That's either home or skilled nursing facility. And prior to leaving to a skilled nursing facility, like I mentioned earlier, they get tested and make sure that they're COVID-free. So I feel pretty comfortable and secure, and I want my patients to know that we're doing everything here to minimize their risk, but at the same time, we're doing this because them waiting and waiting is wrong, because the complications can get worse if the longer they wait. I feel that it's safe for me, and I would bring my loved ones in because I know the precautions that are being taken.